Well, good evening. Already 6:15 p.m. The last hour of this 9-hour long so far will be 10-hour long international workshop. This is very tough, but especially I would like to recognize the great work done by Roberto and the World Bank Group, as well as the government of Ministry of Health of Chile. You did a great job. Thank you so much. And also, I would like to recognize those ladies and gentlemen in simultaneous interpreter room. You did a fantastic job so far. Ladies and gentlemen, please join me, offer them a round of big applause. Thank you, thank you. Well, talking about the ethics as well as good practice, my late father's word reminds me. I was in high school, I think about whole the justice and the peace of the whole world, and he always tell me that, son, the big talk is cheap and the small action is even better. And when we talk about the ethics and the good practice and make a better health, how can we say without the scientific, evidence-based, measurable data, how can we possibly achieve ethics, guide our providers to practice their work ethically? It's very challenging. What I'm presenting now is what has happened in Korea, what has transpired in Korea, the game changer that has made shifting the paradigm of the service providers as well as national health system. Okay, my presentation is about first, the information system, second, collection of information, third, utilization of information. Okay, this is my colleague from NHIS, Dr. Kim mentioned that about NHIS. The way that National Health Insurance System is designed under Ministry of Health, we have two agencies working. One is National Health Insurance Service, one is HIRA, National Health Insurance Review and Assessment Service. And NHIS, what does is collecting contributions and pooling, as well as many great work related to preventive work, as well as the, as you heard, the negotiating drug price. For HIRA, what we do, there are three main functions. One, rule making, the benefit policy support, listing, pricing, setting standards, and then monitoring and the feedback part is claims review, quality assessment, and on-site investigation, and drug utilization review, and a medical fee verification service. And then infrastructure management, this is something that probably you see pretty much unique features of what Korea does. One is Korea Pharmaceutical Information Service. We call Korea Pharmaceutical Information Service, KPIS, which is tracks lifespan or span of the drugs, where they're domestically manufactured or imported. We starting point of lending the birth of drugs to the end consumers, where that which value, which price goes to wholesaler, and then the provider could be hospital, could be pharmacist, and then which consumer, which patient gets it, and then which doctor prescribes that drug to which patients, what volume, what price. So these are all checked by this system. Here, we have in terms of the way the system is designed, is starting with the R&D, And then it shows, as you can see, the, here's point, for example, year 2015, total national health insurance expenditure is about 50 billion US dollars. I wish it is just $50. Then the pharmaceutical expenditure is about 13 billion US dollars, and 25.66% belong to pharmaceutical expenditure. And here we have Korea. Healthcare providers total is 8,800, about 800, and then among them, pharmacists is 21,000 pharmacists, and then 88,000 the healthcare providers. So we have pretty big number of pharmacists in Korea, and how it all starting with the R&D part is there, and then approval and listing, production and import and supply and utilization, monitoring and review and assessment, and post management. All this is sort of our system, that each one has functions, the value that how this system functions and what products, what outcome these systems generate. So these are the sort of outcomes of each related column. And then in terms of collection of the pharmaceutical information, so in terms of any system, we got to have at least 5 clear ideas that what we would like to achieve with this data system. Second, what kind of data we would like to collect. And third, the method of the collection. Fourth, we need to analyze this data. Then what method we would like to use to analyze. And fifth is how we would like to utilize these data. So when we think about this, it's not that it's done one day. It's over years, the HIRA and the Ministry of Health, as well as NHIS, we are working together and thinking about it, and to see how we would like to collect from where. As you can see, HIRA collects data from Ministry of Health, which has benefit list and the ceiling price of drugs. Ministry of Food and Drug Safety, we got approval of manufacturers and importers, approval of drugs. And then Korean Pharmaceutical Information Center, which information for identifying individual pills. Then we have medical institutions, pharmacies, these are the providers, 88,000 providers where that we get medical claims data. This is very critical. We receive about 1.5 billion claims requests annually. So that claims includes what kind of drugs, volume of drugs, as well as the price of drugs is included in claims data. Of course, this is the prescription as well as the dispensing history. Then drug purchasing history. Then we get from local government that approval of wholesalers and registration of sellers of safe and already available drugs. And then the Korea Pharmaceutical Manufacturers Association, Pharmaceutical Trade Association provides history on the production and importation of drugs. And the manufacturers and importers provide applications for listing of new drugs and drug supply history, right? And then wholesalers, they also provide drug supply history, means that what date, what kind of drugs they received, volume, and the price as well. So these all information is collected here. Then what kind of the contents that these information has, you can see the healthcare provider-wise, name of a prescribing institution and drug name, ingredient name, diagnosis, patient name, drug administration dates, and drug administration route, and amount of medical claims for drugs. So these are all the prescribing and dispensing information this has. And then distribution information-wise, supplier's name and the product name, supply volume, date, cost, reason for return, expiration date. Then in terms of what, these are the healthcare providers, they have to provide these contents. And then suppliers, it means that manufacturer, importer, and wholesaler and the relevant association provide the distribution information-wise, production and import record, supplier name, product name, supply volume and date, cost, reason for return, expiration date. So these are, so you can see the contents of all the information related to healthcare provider and supplier, and then Ministry of Health and Welfare, local government, etc. Here, we are seeing that sort of the flow chart of overall flow chart of drug distribution, where that you can see the manufacturer and importer, and there is a serial numbers and batch numbers, each drug, and then the warehousing and shipping. All that information comes to here, the Korean Pharmaceutical Information Service, which HIRA system is linked with this. The service is managed by HIRA. Then from here, manufacturer importer level, shipping is done to wholesaler. Then receiving information, orders received, and shipping and return, that also all information comes here. Then the healthcare provider level, hospital or pharmacies, receiving data and the prescription or dispensing information, that comes to HIRA directly through the claims request. Then the two systems is linked together. And I was in Bahrain last week, the Kingdom of Bahrain, and the HIRA is working with the Kingdom of Bahrain to build its national health insurance system. And one of the reasons that those Gulf countries would like to have HIRA system is that the oil price gone down so much that they cannot afford to keep the current system where that providing healthcare 100% free to they call the national as well as experts. So no experts. So at this point, what the Bahrain government tried to achieve with there are different features, but in terms of drug-wise, they would like to have this system, and then plus the storage information system, where that making sure where the storage stocks of the drugs, if there are how many fills remains, so therefore they can reorder the drugs to the hospital or national storage center. One other feature that the Kingdom of Bahrain would like to have through this system is that which doctor cost National Health Insurance Fund, the monthly, annually, and what kind of drug, either generic versus brand name. So this system can identify, can print out using the reporting function that we can even compare the 100 doctors, who is top 10, cost most money, weekly, monthly, annually, with what kind of drug prescribing. So this is a kind of system that sort of, you can see that, helped us to save millions of dollars, as well as induce providers' behavior to conscious about somebody's watching, somebody's monitoring. I think the presenters before us talked about the there is no system to monitor. Once you have a system to monitor, when you talk about ethics, when you talk about the good practice, sometimes it works well with the system. Then, now, utilization of this information, how we can utilize. As you can see, all the prescription and dispensing information, distribution information, approval information, coverage information comes to HIRA, data processing analysis system, right? This is kind of big data. And global pharma, the groups would like to have this big data, but we never offer opportunity to them. Then what utilization happens here, HIRA does the setting criteria and monitoring of expenditure and quality feedback. Then public and patient get information. We offer the patients the 6 months worth of the medication history and drug approval information and the result from quality assessment of healthcare providers' pharmaceutical use. And we call my prescription at a glance. Then healthcare provider-wise, we have medication history information provided on ineligible blood donor. I'll explain this later. So you can see even we offer this data to academia that they can provide with the research data on pharmaceuticals and research based on real-world evidence. Also, this offered to the Korean pharmaceutical industry that using this data to develop the innovative drugs for helping the citizens in Korea. All right, this is where that I can show you sort of a dashboard that how our system made difference. Here, for example, drop in antibiotic use for the common cold. When we did the quality assessment 2002, 73.2% that providers prescribe antibiotics. And then 2014, it dropped to 43.8%. What's happened here is that each year, when we conduct the quality assessment to all the providers, then result comes out, we open this result to public. Means that Ministry of Health, as well as National Health Insurance Service and HIRA offer this to the media as well as the consumer group. Then it shows which provider prescribes antibiotics on this symptom, which is certainly as I mentioned before, induce the provider's behavior. And think about this, where the safety of patient as well as the money saved, right? And then you can see reduction in the prescription of injection, 2002, 39 to 69%, 39, or about 40%, right? Dropped down to 16%, 2016. This as well, the safety of patient as well as the saving the fund. Then reduction number of drugs per prescription, the 2002 was 4.32 pills. It became the 2014, 3.76 pills. This is evidence-based, measurable data works. And the teaching ethics is great to providers. However, without having this system, this data, it's very difficult to influence at least the Korean providers. I don't know about your country. And here, you can see we have a system called DUR, which is that in America, probably you have very much commercial packages available, but here we developed DUR, which is that the system checks when doctor enter into prescription into their computer system, then within 1 second, that information comes to server, HIRA's server, and it checks drug contradiction, drug age, contraindication, and pregnancy contraindication. Once the contraindication is there, then within 1 second, it alerts the doctor. Then doctor change, option is doctor change that, or if doctor does not change that, then when patient goes to the pharmacy for dispensing, then pharmacist see that sign, then contact the doctor if there is any clinical reason that he is not changing prescription. So if that requirement is met, then drug is dispensed. Here you can see adjustment rate by item. For the biggest one is age precaution. Then second biggest one is the pregnancy precaution. And the third one is here, the drug between drugs, contraindication, and then the within drugs. So you can see the adjustment rate is about, there are 22 million, over 22 million cases we alert doctors, and this reduction of pharmaceutical expenses for this system is not great, but 31 US dollars, 31 million US dollars we saved for this function. And another thing is the promoting self-care by providing information to public, which is it's very important, we think. This is sort of empowerment to our citizens. How we do that is providing all the information related to the drugs they are taking over the past 6 months. And then also image of individual pills, pictures in there, and also shows that effectiveness as well as the side effect of these pills. And also we are providing, as I mentioned before, result of quality assessment is provided to public. So these ranking, when the consumers, before visit provider, they can check what rating this hospital or this clinic has received the last year, previous years as well. So this is where the offering the consumers that with the knowledge, they can make their own choice. Also, other information, whereas that in terms of certain procedures, how much this hospital charges versus how much that hospital charges. So these are all information that we collect and provide to our citizens, empowering them. Then one of the core information in terms of the function as well as the purpose of the HIRA system is the first started with monitoring and try to control expenditure. So what's happening here is throughout the encouraging appropriate prescription and the purchasing of low-cost drugs, reduction of 279 million US dollars each year. And also, as you can see here, about 192 million dollars, US dollars, crowd back since 2010, mismatch between the volume of supply and that of medical claims. There are as you can see, not only the safety, but also the saving the control, the expenditure is something that we have benefit from this system. The other functions of the pharmaceutical monitoring or management system is that this is sort of a side benefit. Well, that the blood donors' medication history. So, for example, 2015, inappropriate transfusions prevented with the medication information of drugs prohibited for blood donation, affected 7,500 people. And the second benefit is providing human tissue donors medication history to tissue bank. And the third benefit we got is sort of using this DUR system as the digital, the epidemic surveillance system. Probably some of you are aware that 2015, the Korea really hit hard with the MERS disease. It spread, MERS outbreak was so severe, so many people died. And at that time, we had the difficulty to control that. So we hooked this DUR interlinked with immigration information. So doctors can see when patients come, two things. One, if this patient visited the region where the MERS virus was started, which is Middle East, right? The second piece is the history of the doctor shopping, where this patient may not reveal which hospital he or she visited before. But hooking up this system, we can see the history of seeing the doctor and the drug prescription or dispensing. We can see that which hospital this patient visited, and that alert the physician to make sure to proper follow-up. So these are how our system has been working. As I said before, my presentation is very different than what so far you have presented, because the ethics and the best practice, or the best morale, these are what we would like to achieve. But Korea's experience, without having the evidence-based, measurable data, there is no effective way to induce or to influence the providers group. Also, besides that, all information helped us to NHIS negotiate drug price as well. So far, what my presentation is pretty much the implementation as well as a practical program, and also how the game changer. We use IT technology as our game changer, and that truly affected how the providers as well as policymakers, the shifting paradigm of how to creating or providing better health care. Thank you so much. Thank you.